Okay, so to begin with, it's worth explaining that we have two basic types of injuries that we see in our clinics. Firstly is your acute type of injury, sprains, strains, tears, joint injuries, for example, going over your ankle or twisting your knee. These are normally sudden, from a fall, from a twist, often quite painful, low to swelling and so forth. And we talk about these in terms of grades. And a grade 1 is almost like a slight tweak, maybe just a little bit of swelling or pain, but ultimately we should be able to get back to our training within 24, 48 hours. And at the other end of the spectrum are grade 4, more severe, a lot of disruption, soft tissue damage, possibly even a fracture. And we know from these type of injuries, once you have a grade 4, you're talking about weeks rather than days getting back to training. And the area I want to focus on tonight is more the overuse or load is another word, type of injuries. For example, Achilles tendonitis, runner's knee, painful knee, iliotibial band syndrome, and plantar fasciitis. Now, these are all fairly common injuries that we see in sport, but they're not exclusive to runners. We see them, in fact, in all kinds of sports. And I think it's worth, again, explaining a few key facts about overuse injuries. Firstly, the cardiovascular system, it adapts to training and training stimuli much quicker than the joints and muscles. And what we mean by this is we're going out there and we're training and we're starting to feel better, feel fitter, heart's getting stronger, lungs are getting stronger. So we want to go quicker, we want to go further. But sometimes we push those boundaries too far. And it results in, if we look at this staggering figure of 80% of overuse running injuries occur due to too big an increase of mileage too soon. And we've got 1 month a year, April, that we actually call Mad April, because consistently every year, come April, we always have the highest amount of these type of injuries seen in our clinics. Probably because of the races that are coming up in end of April, and in May we've got the marathon and the half marathon. So runners are tending to peak somewhere in the month of April. And as a result, some of these athletes find themselves, pushing themselves too far and picking up injuries. Other factors, another staggering figure, 90% of runners have weak core muscles. And just to explain this, if we look at this picture here, if you look on the, my pen's not working very well, but yeah, there we go. If we look at the runner demonstrating good running form here on the left, you can see that he's running with a tall posture, and he's leaning forward in particular from the ankle. Okay, and if we look at the second picture where he's trying to demonstrate what a running posture would look like if you had weak core muscles, you can see that he's more or less sitting down there, and his lean is actually coming from his back. And this is a very common posture that we see with runners that have poor core control or poor core muscles, and very common, leads up to lower back pain, Achilles tendonitis, and runner's knee. Okay, so having a strong core is really, really important. Not only will we reduce the amount of injuries that we see, it's also far more efficient, as you can imagine, to have this kind of running posture as opposed to this sitting type posture. Now, T.S. Eliot's quote has always been very inspirational to me. Only those who will risk going too far can possibly find out how far one can go. It's something that I've often looked at and reminded myself throughout my career. But the only problem with this quote, and perhaps T.S. Eliot wasn't thinking about running when he wrote that quote, there's a little piece missing, and that is the point of being smart or using the sense. And sometimes when we aspire to push ourselves to the absolute limit, we hit a problem or we get an injury. And it's how we deal with that at that moment in time will tell us whether we're able to actually really go on to push ourselves or whether we break down with more severe injury. So we have to use common sense. And even though we aspire to push ourselves as far as we can, not all of us, but a lot of us do, we've got to think what we're doing, and if we get an injury, then we've got to put on the brakes, find out what's wrong, fix it, and then progressively return to our training program. One or two other points. Susceptibility to injury varies from person to person. All different shapes, different size, different height, different weight. Foot shapes, for example. Some of us have flat feet, some of us have high arches. And also, we all have different jobs. Some of us sit all day, which has its own problems, and some of us work on our feet all day, which would offer different problems. So our susceptibility to injuries can vary from person to person. There is also a detraining effect to joints and the surrounding structures. What I mean by that is, for example, let's say you've built up your mileage to 50, 60 miles a week in preparation for a marathon, and then for some reason or other you've got to take some time off, let's say, for example, 4, maybe 5 weeks. So you have all that time off, and then you come back, you're feeling fresh, you're feeling ready to go, so off you go and you pick up where you left off at 50 miles, and then all of a sudden you pick up an injury. Well, that could possibly be because of the detraining effect that occurs to joints and muscles. And when we've had that extended kind of period, we should actually just take a look and perhaps building it up from 30 or 40 miles a week and progressively getting back to be a better option. Growth factors in young athletes can increase the risk of injury. Obviously, they're growing all the time, they're changing, they're developing, they're increasing their weight as they're growing. So things are moving and changing all the time. We've got to take that into account when we look at their training programs, and we must listen to these injuries. Sometimes it's just purely growing pains, but quite often it's because something has changed and caused an irritation. Find out what the problem is before forward. Youngster growing. And overuse injuries can often be complex and multifaceted. And I'll give you an example. I had someone in a few weeks ago who had presented with back and knee pain. We could see that his core was extremely weak. He had poor running posture. We had a look at him running, and he was that example that I showed you earlier of that sitting type posture. His job meant that he sat all day, he had flat feet, and he was wearing the wrong shoes. So there's a whole array of issues that we've got to look at, and we've got to resolve if we want to get the right result here and try and reduce his back pain and reduce his knee pain. It's not always as straightforward as saying, well, you've got knee pain, let's have a look at your knee. You've got to look at things holistically. So in summary of overuse injuries, we've spoken about the importance of the increase in mileage. We've talked about weak core muscles and the effect they play in terms of making us more prone to injuries. Also an increase in intensity. So for example, you've been running for maybe 2 or 3 months, and you've picked up your distance, everything's going well, and you suddenly decide, right, it's time to start some speed work. So off you go, you hit this long hill, and you do 20 repeats, you jog back down between each one because you're fit enough to take it. But then you must question, are the muscles and are the joints, have they adapted? And you again need that time for adaptation. So perhaps adding in 2 or 3 hill repeats into your long distance training to begin with might be more appropriate than trying to go at your interval training all at once. I hope that's not my mic, sorry. Training surfaces. Maybe running on glass is not one of the options, but certainly, again, if we're going from doing all our training on soft grass and then we carry on the same volume of training onto roads, then there's a high risk of us picking up an injury. So this is a transition. We're talking about transition here. So if you know that you're going to go out and do a lot of road running, and so far all you have done is grass, a good transition would be maybe doing 75% of your training on grass and only 25% on road, and slowly make that transition. So this is really common, what we see, these kind of presentations. Poor recovery and preparation, hopefully not as bad as Homer Simpson here, but nonetheless, there's a very good adage about recovery, and that you actually only improve during periods. You don't improve whilst you're training. So making sure that you fit in the right amount of recovery for your training is important if you want to improve. Biomechanical factors. Running shoes. If we look at this picture here, we can see that this runner here, his shoe is collapsing inwards. And if you look at this red line here, it's actually going out at an angle up to his knees. So it's suggesting that this kind of action is actually not only could potentially cause an injury at his ankle, but also at his knee and his hip. So the biomechanics are a very important point of making sure that we get these right. And of course, that comes down to making sure we've got the sort of footwear. Yes, I'll come back to that. A friend of mine, in fact, he's a GP, so he should know better. But any training for the recent Paris Marathon, did all his training, everything went. Did the race, he did a PB, fantastic time, so he was well chuffed. Came back, gave himself a little bit of rest, started to pick up training, and within a week or so, started to pick up a injury. So he came to see, we had a look at his mechanics, we looked at his range of movement, everything looked fine. I looked at him running and noticed that he was limping. Took his shoes and socks off. This isn't the picture, but he had that kind of presentation. So obviously, he was in a lot of pain with that foot, and so he shifted his weight to the opposite side, picked up a hip injury. Had to offload. Not any problem. Again, incorrect footwear. We've got to make sure that we are the right kind of shoes for our right kind of feet and our right mechanics. And we're very lucky because in Edinburgh we've got 3 very good shops, all of which have running machines in analysis using 3D and 4D video cameras. So, sometimes I feel, well, it's great to go and buy things online. We all use the internet, well, a lot of us use the internet for shopping. But I think on this, if you're serious about your running, I certainly would use one of those shops and have a careful look at your biomechanics to make sure you are buying the right shoe. So we come to self-treatment. What can we do ourselves to help ourselves if we start to hit a problem and we pick up an injury? And it's got to be, the first question has to be why this injury. I haven't fallen over my ankle. I haven't injured myself in any way, but I've had this slow pain starting to creep up, run after run, getting worse and worse. So we've got to think, what possible things? Is it the shoes? Have I changed my shoes? Have I changed the shoe type? For example, here we see the glove, which isn't a shoe at all. And this is very popular at the moment, and it really works well for some people, but it's not for everybody. And the other thing about it is, in order to run with something of this type of shoe or non-shoe, takes about a year, if not longer, to adapt to that kind of shoe. And I've seen people just come home, they've worn normal shoes, they've worn these kind of shoes, for the problem straight away. Again, it takes time to develop sufficiently to be able to kind of a shoe. Sometimes our shoes are a little bit too warm. It might be worth thinking of changing them. To figure out because you've taken out the course, you've sorted it out, perhaps the running shoes, perhaps your training, you sorted this all out. You now have an injury which you allow time. You've got to think carefully. Some the rest, ice, compression. We're often asked, an inflammation or you have tissue damage. So, for example, you go out for 10, you're going to get some form of standing. But nonetheless, people see standing in the river because we know from training you damage. And of course, heat, on the other hand, is really for when we've got muscles. and relax the muscles. So I've spoken about improving things like foam and tennis balls in order to get into the deep muscles to release them. This is an example of some of the exercises you can do. Some of them work, some of them are really effective. ITB, for example, is not that great, but some people feel it really does help. Self-massage, stretching, dynamic and static. I'm often asked, which should I be doing? Well, I personally feel there's benefit from doing both, and it's finding out more about yourself, finding out what works for you, okay, and getting a routine that minute. And again, think holistically. Don't think stiff, you've got a stiff hamstring. Don't just focus on releasing that one hamstring. Think about both sides, think about what's above, what's below, the calves, the lower back. Try and think holistically about your approach towards your recovery. And talking about holistically, you were asked the question, how many points do we use in the body? And the answer to that question is that we pretty much use every joint at some stage during running in some way. So the answer to that is actually 360. So we'll find out at the halfway actually who got that answer right or got closest to it. I did see someone put down 2. So anyway, so that's a bit about what you can do to help yourselves. But sometimes it's not happening. It's not working out. You can't resolve the injury yourself, so you have to look for help. And what we end up doing is taking a detailed history, taking a timeline, trying to figure actually what's happened, what's the progression, what are the likely causes. We may carry out a biomechanical assessment again, what you're running, what you're walking, certain exercises that helps us to be able to determine what that diagnosis is. And then hopefully one of the first things we'll be doing is advising how that athlete can get or remove or correct the cause. If we don't do that, then any treatment we're going to do, any advice we give you is going to be worthless, because eventually that injury is going to come back because you haven't changed anything. So yes, modifying and looking at alternative training might be the way to go. Getting on a bike, getting in the pool and so forth. Remember, the heart and the lungs don't necessarily know exactly what form of training you're doing. So although it's not actually running, there are things you can do to actually stimulate those muscles and help you to maintain your fitness. Don't just give up. Which brings me to the point of, should you rest or not rest? You know, we used to say, I know years ago, we used to say, oh, you've got Achilles tendonitis, well, you better take 6 weeks off. We hardly ever tell athletes to completely rest. There is nearly always something you can do. If we take, for example, Achilles tendonitis, what tends to happen there is you get an inflammatory reaction. You get scar tissue and you get gunk basically form around the tendon, which is almost like super glue. And if you do nothing, it just allows that time to get stronger and stronger. So when you do come back to your training, having taken a long period off, you know, within a couple of runs, you're back to where you started, and it's an even bigger problem to get rid of. So resting completely is a rare thing that you hear about these days. Eccentric strengthening is not something I'm going to touch on tonight, but certainly it's the way to go at the moment. And what eccentric training is about strengthening the muscle in its lengthened position. And we found that this helps to improve running efficiency, it helps to reduce injuries, and it's certainly something we use extensively in terms of recovering from injury as well. Where are we? Yeah, the other thing is as well, once you've got over the injury, you can't just pick up where you left off. You've actually got to think about your training again, take a step back, and slowly, progressively improve your training until you get back to where you were. At the end of the day, it's about getting to the start line. So you have to have a look at your training and say, well, maybe I'm not going to be able to achieve all the training that I planned out, set out to do. But go back to T.S. Eliot's quote about, and what I suggested about being smart about your training. And saying, well, I want to do this race. I want to get to the start line without pain and actually finish the race. So sometimes it's worth talking to your coach or sitting down and working your planning, work it back from your race or whichever goal you've set to aspire to, and try and work out a sensible plan to get there without injury-free. So we talk about alternative type of training. I touched on it a couple of times earlier. So we're really talking about, for example, the cross trainer. Now this is a great tool to use. I know you probably don't have them in your lounge, but they are readily available in the gyms. The great thing about the cross trainer is you're able to use the running muscles, use the running mechanics, but you take away the load. So perhaps this is a good tool to use during injury. Not in every case, but certainly I advise a lot of my patients to get onto the cross trainer, keep yourself fit, keep the muscles going whilst they're recovering from injury. I think that's my daughter. Aqua jogging is another great tool. Again, you're able to use the running muscles, and I've used this extensively in professional sport, and I've told the guys what to do. They go down and they come back and they say, well, yeah, that was okay, you know. And I said, no, you're not doing this right. So I'll go down with them and I'll show them exactly how you do sprints in the water. But the great thing about this is it's completely offloaded. Your feet don't touch the bottom of the pool, and they're going absolutely flat out. Some of them actually crawl out of the pool, they're so tired. So it's a great way to keep yourself fit, still use the running muscles, but be able to help recover from injury. Upper body circuit training, so that's selecting a bunch of exercises, 9 to 12 exercises, doing lots of reps, very little rest time. Again, you're working your upper body, cardiovascularly, you're still using your heart and lungs, but you're giving an opportunity to allow perhaps your lower limb injury, whatever it is, to recover. Now, the final piece of the jigsaw for me, or the missing link to effective and efficient training, running, is the core, glute, and hip strength. And if we look at this picture here, you can see that the central hub, if you like, is the hips or around the pelvis. And I'm sorry about the choice here of relating a bicycle hub to the spokes, the hub being the pelvis and the spokes being the muscles that are attached to the pelvis. And if you imagine you're riding a bike and all your spokes come loose, well, obviously the wheel is just going to wobble all over the place, and apart from it being totally dangerous, it's also going to be totally inefficient, and eventually it's going to break. And it's not dissimilar here in terms of the pelvis and the muscles around the pelvis. If we have a weak core, we have weak glute muscles at the back and weak hips, then we're going to have that same kind of effect, a lot of disorganized type movement patterns when running. It's not efficient. We're not going to be maximizing our speed and our power translation, and also we're more likely to pick up injuries. So typical examples I've got here are like basic core type training, that's called the plank, and you can adapt these exercises to make sure that you are developing strength in both the core, the glute, and the hip at the same time. Other examples here, this is a combination exercise. Starts with what's called the clam, and it works from bottom to top. In terms of the type of exercise to strengthen those three areas. And this is an exercise, the overhead lunge, we use extensively in professional sport, because this really, to me, this is the bee's knees in terms of combining those three areas in a functional pattern. Again, another functional type of exercise, raising the knee with if you can see the elastic at the back there, resistance. So he's working the stabilizers on his left leg, the standing leg, and he's working the hip flexors on the leg that's with the resistance. And again, cross trainer, another great tool. You can help to practice engaging these muscles, engaging your core, engaging the glutes. So it's a great opportunity to do that. And another way you can do it, if you're really focused on trying to get a better running posture, is to go out and rather do a continuous run, do a run jog or a run walk. And during the run, focus on making sure you're engaging these muscles, and when you're walking, just relax and start to build that up. So, in summary, prevention is always better than cure. Think about progressions all the time. Sometimes you have to take a step back and then progress again. Transitions, remember what I was saying about running surfaces. Okay, make small transitions, build up your exposure to harder surfaces, for example. Keep the variety in your training. Don't be focused on one type of sport. Try and mix the sports up. That's going to reduce your chance of getting injured. Active recovery. Remember what I said about the core, glutes, and hip strength. Remember good footwear. So Thank you very much for listening. I hope that was useful. Thanks a lot.